Planned Parenthood is considering a courtroom challenge to a decision that strips funding from its North Carolina branch. Earlier this week, North Carolina lawmakers approved a measure to cut funding for the group by more than $400,000 because Planned Parenthood performs abortions. North Carolina is the third state in recent weeks to approve this kind of measure after Indiana and Kansas. And this latest cut goes into effect July 1st. Planned Parenthood officials are considering options with their legal teams. And I'm joined now by Melissa Reed, Vice President of Public Policy for Planned Parenthood Health Systems. Melissa, thank you for your time. Many people see this as a continued, what they believe is a war against women. What are the options that Planned Parenthood in North Carolina is looking at this point?
We're looking at all of our options, including litigation at this time. I'm sure we'll make a decision very shortly on how to proceed. But this is a very serious attack on women's access to basic health care.
What specific litigation or legal options can you tell me about?
Well, the attack on Planned Parenthood is quite frankly unconstitutional. This is what would be called a bill of attainder, where a state legislature is trying to punish an entity through the legislative process instead of the courtroom.
And due to these cuts, the Planned Parenthood in North Carolina says it will now have to cut its teen pregnancy prevention and its adolescent parenting programs and force its low-income patients to pay out of pocket. Obviously, if you're low income, how are you going to pay out of pocket for necessary things like mammograms or pap smears that women, certainly we know, need?
That's absolutely true. In some of our counties in North Carolina, health departments are already seeing a 12 to 14-week waiting time for those women to get that kind of care, and they have always relied on Planned Parenthood to fill that need as an essential community provider.
What do you make, though, the push in North Carolina, as we've seen across the country, are abortion opponents who organized because they say that federal funds are going to Planned Parenthood to perform abortions, even though we know federal law prevents that from happening. But this reason continues to be floated out there, and it is not based in fact.
That's true. The Hyde Amendment absolutely prohibits any of these dollars to be used for abortion care. Planned Parenthood operates just like a hospital. We are reimbursed only for those services that we provide, and they are very carefully tracked and monitored.
So as you ponder and the team there ponders the legal options that are available, meantime, as you say, there are people being hurt by this. The clock can't be on your side here. When do you have to decide what to do next?
I imagine we'll have a decision by this time next week.
All right, Melissa, we want to get an update from you as you and the team at the Planned Parenthood there decide on what to do next after this measure was passed in North Carolina, similar to already in Indiana and Kansas. Thank you.
Thank you.